Okay, well, welcome to this student tutorial with your OT tutor. The topic we're covering today is all about when showering is tricky. So we're going to go through an actual case study of a client who's having difficulty with showering and just talk through some of the OT process. And we'll do some aspects of that process in a little bit more of a deep dive, just to help how you might develop your clinical reasoning around different stages of the process. So I'm going to dive right in because it's going to be a short session that hopefully we can get through the majority of within about half an hour. So before we get any further, though, I just wanted to do an acknowledgement of country. So I'd like to acknowledge the Quandamooka people, who are the traditional custodians of the lands, winds and waters where I'm situated to provide this session today. And I pay my respects to elders past, present and emerging, and acknowledge all Aboriginal and Torres Strait Islander people present today or watching the recording. So what are you going to get out of this session? So basically what we'll do is you'll be able to outline the steps involved in the OT process when you're assisting a client who has difficulty with showering. You're going to be able to use the PEO to consider factors that may contribute to a person having difficulty with showering. So if you're an OT student, you're probably here at uni, they talk about all these OT models all the time, but you may not necessarily see them in use when you're out on placements. So some of these tutorials will actually be pulling in some of those models and just showing you how they can actually be helpful in a practical way. You'll also be able to identify some information gathering methods that can be used to determine why showering might be difficult for somebody, and then be able to compare the features of some common bathroom assistive technology, some equipment, and select an appropriate option for this case study person. And then we'll have a brief description also of how you can evaluate the effectiveness of your intervention. So basically go through a bit of a steps of the OT process, and some of the parts we'll do in a little bit more detail than others. So the session plan, I'll give you a little introduction to me if this is the first time you've come to any of my sessions and what your OT Tutor Connector is about. Meet Paula, so that's the case study person we'll be discussing. I'll run you through the OT process just in a nutshell, and then we've got a few case study type activities that you're welcome to either contribute to, or you can just do it in your own time, or if you're watching the recording, you'll be able to stop and pause and have a go at the activities as well. And then just a couple of minutes for any questions. If you've got questions as well at the end, you're welcome to ask them once I stop the recording. Okay, let's get going. So for those that haven't come across any of my things before, just a very brief introduction. You can find out more about me on my LinkedIn profile or on my website. But I've been an OT for about 16 years now, and I've worked across both public and private sectors. Worked in lots of different caseloads. So anything from hand therapy and burns to neurosciences, aged care, orthopedics, lots of different things, mostly working with adult clients. In terms of my experience as an educator, so I've actually worked as a student unit supervisor at a large teaching hospital where we would have had about 70 students most years come through and do placement with us. And I was job sharing that position where we'd actually coordinate student placement. So a lot of what we'll be covering in this membership that this is sort of a bit of a preview of is about helping prepare you for placements, all the different skills you might need when you're out on placement, or even if you're a new grad still developing those skills. The other background to me is that I work as a sessional academic for ACU, so I still know a lot about how universities are teaching students and what you need to really do to connect what you're learning at uni to what you need to know when you're on placement and when you're an OT. So that leads me to what this membership is all about. So it's called Your OT Tutor Connector, which is the new name I've recently called it something other than the student membership. So basically that comes from the fact that it's all about connecting the dots between what you learn at university and what you need to know to be a real life OT. So it's designed particularly for OT students in mind, or some new graduates, or even if you're an international OT, maybe trained in a country where English is your second language, some of the sessions may be helpful for you as well, and you're welcome to come along. Once this launches, which will be officially in January, the last week of January, it'll be ongoing weekly sessions, 30-minute sessions that are live each week. You can either come to the live sessions or you can watch recordings as well. But they'll be really succinct, targeted, practical sessions doing a deep dive on different topics. So if you go to my YouTube channel, there's a few other examples where I've done sessions on clinical handover or documentation. This is a bit more of a case study example that we're doing today. So yeah, every session that I run will be then put on demand. You can access that whenever you like, and there'll be lots of free resources as well that you can download. And once we build up a bit of a membership, there'll be an opportunity to get a bit of peer support or discussion boards for Q&A, or if you need a study buddy, those sorts of things, you'll be able to connect with as well. But Let's get into the main part. So just a disclaimer, this session will provide you with an overview of the OT process and some approaches for developing your clinical reasoning, but it's not designed to be a prescriptive or comprehensive protocol that's going to work for every time you come across somebody that's having difficulty with showering. So make sure you always chat with your supervisor, whether you're a student or a new grad, if there's anything that doesn't seem to fit with what we're discussing today. But let's meet Paula. So Paula is a 78-year-old female. She has diagnoses of osteoarthritis and type 2 diabetes. She lives alone in her own ground floor villa, and she currently receives assistance for domestic tasks through her aged care package once a fortnight. And she currently mobilises with a walking stick. So you're a community OT and you've received a referral to see Paula because she's having difficulty with showering. So that's Paula. We're going to keep coming back and discussing her throughout this session. So you get a referral like this. What is the actual process that you would go through? Now, this sort of is a very simplified process, I suppose, that's loosely based on, you may have come across the Canadian Practice Process Framework, the CPPF, that they might discuss at some of the universities. It's got about 8 steps, I think. This one's just sort of condensed it down to about 5, just key ones to get us started for this first one today, but I will be touching on some of those other models and frameworks once the membership starts next year. So the first thing you want to do when you get the referral is that you want to be really clear on what's the purpose of that referral or the goal. Then you want to know, okay, can I prepare in advance before I actually go out and meet Paula? Is there anything I can do to be as prepared as possible for that initial assessment? Once you're out there doing that assessment, that's where you become a bit of an OT detective, and you use lots of different assessment methods to try and find out, why is Paula having difficulty with showering? Because you really need to understand what the difficulty is. You can't really make assumptions about what it might be difficult, the reason is. You need to do that detective work, and then you can get to the intervention, which is where you're going to trial some solutions. Once you get something that looks like it's going to be the winner, that's when you implement that. And then finally, once you've got something that you think is working, you need to still come back and evaluate to make sure that it worked at some point in the future. So we're going to go through each of those steps in a little bit more detail now. So the first one that I said, if you think back, was to clarify the purpose or the goal. So in this case, it's actually quite simple. The referral came through stating specifically what they'd like you to address, which was that she has difficulty with showering. So nice, easy one to get started. Sometimes though, we'll get a referral and it won't necessarily state what the activity is. So we might need to be a little bit more broad in our preparation in terms of thinking about what are all the different activities that may be difficult for the type of person that's been referred to us. And we can talk about those sorts of generic referrals next year as well. But even if you do have something specific in terms of they want you to address showering, you do need to think about whether there are any other issues that may need to be addressed as well. So you might tackle the showering, but should you be thinking about other things that are difficult that you might want to keep in mind while you're working with Paula? And then while we know that she wants to get, she's having difficulty with showering, we don't necessarily have a lot of detail about exactly what that goal looks like. So does she want to get back to showering every day, standing up, having a shower? Does she want to be able to just independently have a shower a few times a week, sitting down? So we can clarify all that once we do the next steps, which are a little bit more of that information gathering. So now we're up to the part where you're going to basically prepare for your initial assessment. So you get the referral, you know you're going to be working on showering, you know a little bit about Paula. This is where you can actually use your PEO. So if you're a student and your supervisor says, we're going to go see Paula, have a think about some of the things we might do with her. These are some of the things that you can actually start thinking about before you go out there. So what I've got for you, I'll drop a link in the chat in a second, is a bit of a worksheet. So for some of these steps, I'll give you the answers like I just did in that last one. And for others, there's 2 where I'm going to let you basically have a chance to have a bit of a work through yourself. And if you're watching the recording, or if you're here live, I want to stop and watch the recording and do that later, then you can spend a little bit more time going through it, but I will give you some answers as well. So the first, step 2 is now thinking about what we can prepare in advance. So that's thinking about what are some of those barriers or enablers that commonly come up that mean that cause difficulty for somebody in terms of their showering, particularly when you know a little bit about the person. So what I'm going to do is I'm just going to find the link for this worksheet. Bear with me for a second. Also these slides as well, whiz through them quickly. You don't need to scribble down notes. I'll make sure I share the slides with you afterwards as well. And bring back my Zoom chat. So hopefully in the chat now, you've just got a link. It'll just take you to a Word document, which will be a blank worksheet. I'll bring up my version of it to show you. And hopefully that's what you're seeing now on your screen, is a little worksheet like this. So this is where you've just got a bit of space to actually work through some of these things. So now at this point you can unmute and you can throw answers at me, but we'll go through probably only 5 minutes or so on this activity. So if you're pausing watching the recording, you can do this a lot slower and take your time and have a real think about it as well. But and if you are watching the recording, I suggest that you do that now, because in a couple of minutes I will start giving away some of the answers. So pause now if you're planning to do it yourself. But basically what you need to think about are, what are some of the person factors that make it difficult for somebody maybe to have a shower? What are some of the environmental factors? And I've given you a few little subheadings to think about. And what are some of the occupation factors? Now, if you've done sort of PEO type case studies at uni, this might be quite familiar and easy to you, but if it's completely new and you have no idea what you should be putting in each one, I'm going to run through my answer sheet now, and I will give you the answer sheet at the end as well. But straight away, if you did want to interact, you're welcome to start dropping some things in the chat in terms of what are some person factors maybe that you might want to consider. So if we think about physical or motor, what are some physical reasons why someone might have difficulty showering? So it could come down to things like their balance, and that affects their ability to transfer in and out of the shower. Could even be things like their ability to bend and reach, say to wash their feet. Sometimes it's their hand function, their ability to actually operate taps and things like that. So that's kind of what I'm getting at with these sorts of things, what can you put in here? So I'm going to bring up my answer sheet now. So if you're watching the recording and you don't want to see the answers, now's your chance to pause. Otherwise, here they come. So if we go through the person factors first, so anthropometrics are just things like height and weight. So you'll need to sort of have a bit of an awareness, because that's going to impact whether you might need standard equipment or bariatric equipment. Already gone through some of those physical reasons, but there's also things like how long can they stand? Is that difficult for them? Cognitive reasons could be that they have difficulty remembering the steps of the task, or they might skip or repeat task steps, or it could be difficulty with problem solving. Say they've got brand new taps installed and they can't quite figure out how to adjust them correctly. Sensory reasons could be that they have decreased vision, and that maybe is impacting their depth perception when they're trying to transfer over a hob, or maybe it's reading the shampoo bottles and they're getting them mixed up. Or it could even be things like that, they feel really cold, or the heat is actually making them fatigued. And some psychological factors could be that there's a fear of falling in a wet bathroom, or if they do have some cognitive impairments, then it can actually be quite overwhelming as well to try and sort of plan through, how am I going to get through this task of showering, when it's hard to actually remember the steps. If we go to environmental factors, so again, if we think of the physical aspects of the environment, so we've got, is it a shower or a shower over a bath? If it's a shower, is there a hob, which is that little step that you get over? If it's a bath, how high is that bath edge? And we'll look at that in terms of some equipment in a minute. Is there a curtain or a glass screen? What type of taps are they? Is there a grab rail? What's the floor surface like? So is it really slippery tiles, or are there floor mats everywhere? And even how much circulation space is in the bathroom, if they're maybe using a forward walker or something to get into the bathroom. But sometimes we fixate sort of on that physical aspect of the environment, but it's important to think about the other aspects. So socially is things like, is she always home alone when she is having a shower? She might have a daughter. Would her daughter provide assistance if needed? And home ownership, because if she's renting versus if she owns the home, then that can impact what sort of equipment or grab rails and things like that that we can put in. Culturally, depending on, some cultures may have different expectations around personal care routines and how showering should be completed that we should be aware of. And institutional things could be like, does she actually have funding to access this equipment that we're going to prescribe? Or if we're saying that she needs some carers, does she have access to those supports as well? And finally, for occupation, we're thinking about, okay, what time of the day does she have her shower? Is it morning, afternoon, or evening? And how tired is she when she does that shower? Does she need to be sort of at that certain time every day for her routine? In terms of the length of the task, so has that changed? Has it suddenly become much longer or much shorter because she's leaving out steps? And maybe thinking about how does that compare to what we'd say a standard shower maybe, and there's probably no standard shower. I know my family, some people shower in 2 minutes and they're out, and others seem to be in there for 10, 15 minutes minimum. So thinking about maybe what's more so changed and what's normal for her. Task steps, so it doesn't involve extra steps like hair washing as well. And if she's doing that, is that every shower or just some of them? Nature of the task, so we're maybe assuming that she likes to shower, but is she actually somebody that prefers to sit down and have a bath? And then also the frequency, so how often would she like to shower? All that will feed into sort of those occupation things when we're trying to set a real clear goal. So are we aiming for her to be independent with showering every day or something else? So like I said, hopefully if you that was really quick, so I'm trying to keep it all to the half hour, but if you want to go back and watch the recording, you can have a go and test yourself and see how many of those things you can remember and just see if you can add any more to the list as well. There's probably plenty of other things that you can add in there. Okay, I'm going to jump back to the slides. So that sort of gives you the preparation. So you can think about if you had all those sort of thoughts in your head before you even go out to do a visit, and you could probably welcome to save that worksheet, the answer sheet, as a bit of a cheat sheet for you if you're out on placement, about to do a home visit to somebody that has trouble showering. That will give you maybe some things that you might be looking for when you're out with your supervisor doing that home visit. What are some of the things that your supervisor is going to be looking for that will help us decide what intervention is going to work? So the next step then is to be an OT detective. So this is basically asking, how can we find out more about why showering is difficult for Paula? So you can think about this as all our different assessment methods. So things like interviews, observations. So again, if you're playing along at home, watching a recording, have a pause and think about maybe what are some of those things we could be doing to find out more information about why this is difficult for Paula. And then what we'll do, you can jump back in. If you're watching along and now you're keeping up, you can drop some things in the chat, but I'm going to keep moving along and give you some answers to start with. Just FYI, this is kind of a really quick session. Next year, what we can do as well, when we have longer, we have weekly sessions, we can slow that down and do some of these case studies over a couple of weeks and really go through each step a lot slower as well. So there is a chance for you to chat and talk about things if that's helpful for your learning. We'll see what the consensus is, whether people want slow case studies chatted through or whether they prefer things that they can work through in their own time. And we'll have a bit of a mixture of both. So what are some of the assessment methods or the information gathering? So we could definitely ask Paula. So basically do an interview with Paula, and that's something that we definitely would do. So that's looking at trying to ask her about some of those things we prepared sort of in the last question. We don't really want to put words in her mouth and say, oh, is it difficult for you to transfer? Do you remember the steps? Because sometimes it's easy just to ask more open questions to start with and see if she can describe to us why she's finding it difficult. But if she's having trouble describing it, that's when we can use some of those prompting questions to try and dig a little bit deeper. If she has some family or other carers that are already involved, looks like she doesn't have paid support for showering at the moment, but maybe if she's got family members involved, like a daughter or a son or daughter-in-law, we can maybe ask them if they've got any thoughts on why things are difficult for her. Then we do some sort of observation. So this is where we actually watch someone do the activity that's difficult for them. Because sometimes people can explain to us, oh, I think it's difficult because of this. But when we look at somebody do the activity with our OT brain, we can actually see some other aspects that may be difficult that they hadn't really, they weren't really aware of. So in terms of observations with showering, if somebody's actually in a hospital setting, often we'll actually do the whole showering assessment. So instead of a nurse helping them do the shower, it would be an OT doing the shower. So we see the whole steps all the way through exactly how they would do showering. Sometimes in the community setting, we don't either have time or the person doesn't feel comfortable kind of doing a full shower in the house. So we might do more of a simulation. So we'll get Paula to show us how she steps in and out of the shower. She might simulate how she can reach all her body parts or talk us through some of the steps. And we kind of try to do a bit more of a simulation in terms of our observation. As part of that, we're looking at the environment. So looking at what sort of, does she have a shower or is it over a bath? What sort of taps? Is there grab rails? What's the floor like? And if she's in a hospital, this is obviously a community example. Sometimes it's really helpful to have photos of what their person's bathroom's like, because the way people describe it may actually be a little bit different to how we're envisioning it. And then sometimes we can use standardized assessments. It's probably not sort of our go-to to start with in reality, even though at uni they teach you lots about them. Often we'll start with a more informal, non-sort of standardized observation or activity analysis, but we can use more standardized assessments, things like maybe the AMPS or the PRPP, which are more cognitive-based assessments if that was the main difficulty for people. But that's probably where we'd start. Okay, so basically, they're all the different things we're doing. I'm kind of giving you some clues for how we'd gather the information. Say we've done a mixture of those things with Paula. This is the extra information that you've got now. So we know that in terms of her anthropometrics, she's a standard height and weight, or sort of less than 100 kilos, which is what a lot of that equipment is rated to. Her setup is that she's got a shower over a bathtub, and there's a curtain and a handheld shower hose, but there's no grab rails. She's demonstrated that she's got decreased balance during her transfers into the shower, and she did actually need some minimal assistance to help with that. She reported some difficulty with her vision as well, and she told us that she's fearful of falling during her shower, and that's the reason why she's been avoiding to do it. But she would like to go back to showering daily. So now we've got all that information from our assessments. We need to think about what the intervention could be. Now, sometimes if it was actually more a cognitive type issue, then we probably wouldn't jump straight to introducing equipment. But in Paula's case, it looks like the main difficulty is related to her balance and mobility and that fear around her mobility. So the obvious first step is to trial some equipment that's going to make it easier for her to do her transfers, to sit when she's showering, so that fear of falling is hopefully less, and also that she's feeling more comfortable and confident to shower. So what you can do is I've dropped in a link for a website called NED, which is a National Equipment Database. Really good place if you're trying to just find all the different types of equipment or assistive technology that are out there. Again, there's another worksheet which I'm going to jump to the answers to show you. But if you're playing along at home watching the recording, you can pause and go through this slowly and have a really good look at all the different options on the NED website to find out what's available when it comes to equipment. But if I jump to the worksheet just to show you, so this will be activity 2. Now that this is a link that you can click on to get to the website. And basically what this is asking you to do is maybe from that website, you'll see there's hundreds of different items, but maybe choose the top 5 that you think could be possibilities for Paula that would help her, given that she's got a shower over a bathtub. And then just start to think about why would that be helpful or not helpful. And basically they're sort of your clues for why you might decide to choose one over the other. And sometimes you might need to trial both options or test things a little bit more with Paula to come to the right decision. But you can jump on the website and have a little look through, but I've chosen 5 now just to run you through for this example. So as you can see, yeah, hopefully the first option is a bath board. So when someone's got a shower over a bath, it's obviously the cheapest, easiest way to go to. They're probably about $80 each, but some of the considerations that you need to keep in mind is you need to think about the height of the bath edge. So the bath board sits directly on the edge of the bath. So if that bath edge is too low, so like lower than somebody's knee, that means they actually need to do a sit to stand transfer onto a seat height that's lower than their knee, which is actually really hard to do. We also need to think about on bath boards, there's no backrest, but do they need that for their support? Like I said, the bath board sits directly sort of onto the bath itself. And on that NED website, you'll see some pictures where the bath board is actually on the bath. So it needs to be a pretty normal shaped bath. You know, triangular spa baths, it's not going to work, or really funny shaped baths, not going to work. But good thing is it's not too bulky. So if somebody else was using the bathroom with Paula, she lives alone, so probably not. But if you needed to move it in and out, it's relatively easy to take and store, but it might be a bit of a challenge to set up again. So the transfer bench is slightly bigger and bulkier and more expensive, but you can see basically you can adjust the leg height. So it doesn't matter how low the bath edge is. If it's really low, you can put this in and make the seat height a nice, comfortable height to transfer onto. Other thing is it does have the backrest as well, but like I say, it is bulkier if you do need to move it for in and out, but it's not actually on the bath edge itself, so it doesn't really matter too much what the shape of the bath edge is. Another option is this swivel bather. It's like a chair that basically turns. Again, a little bit more expensive, a little bit bulky, hard to store and remove if other people are using the bathroom. You just got to check the weight limit. I'm not sure if there's bariatric options for this and maybe what their weight limits are. Not really applicable for Paula, but just something to keep in mind for others. You do need a bit of strength and balance to basically be able to swivel and turn that seat. So that could be a little bit of a consideration for people as well. And again, needs a standard shape, pretty standard shape size or bath so that it will fit on there, because those little handles at the end just sit on the edge of the bath. Another slightly fancier option is a bath lift. They've got different fancy names depending on the model. But basically, if the person actually wants to sit in the bath and have a bath, not just sort of have a shower spray on them, then this one actually lowers them all the way down into the bath, but it does actually move. So that can be a little bit unnerving for people if they're a bit nervous about that moving. And usually there's a remote, so you just need to double check that they have the hand function and the vision to be able to operate that remote as well. And finally, another one which I wouldn't recommend, but sometimes people will come across, is like a little stool. So if you can imagine that if that was in the bath, they still need to step over the edge of the bath and then sit down on the stool. They're not really able to slide across to transfer in, which is what they can do with the transfer bench here or the bath board. The whole idea is you sit down on the edge of the bath and then sort of swivel your legs in and slide across into the bath. You can't really do that with the stool. You need to step in first. So it's also not really stable if you've got a bit of a concave bath edge, but it is compact and easy to move. But in general, wouldn't recommend these for putting them in and into a bath itself. So if we think about all those different options, like I say, we don't know a lot of detail about her bathroom yet, but if I give you a bit of a clue in terms of maybe she's got quite a low bath edge, I can give you the answer back on the slide in terms of what you think might be the best option, considering all those different factors as well. Just jump onto the slides. So this is the winner that I would go with, the transfer bench. That YouTube clip, which you'll be able to get when I drop in the slides, the link to the slides, actually shows you how you do a transfer onto a transfer bench and which way the rail goes, like that handrail, is it inside the bath or outside the bath? The YouTube video will explain that for you. But basically this means that she'll be able to transfer in and stay in a seated position. She can adjust the seat height to make it a bit higher because we do that by adjusting the legs. It's got a coloured handle. We know she's got some vision impairment, so by having different contrast, like that darker handle maybe against her white bathroom tiles, it'll be easier for her to see. And we know she's already got a handheld shower hose in place, so that's easy for her to sit down and shower. But we may want to consider adding a grab rail in the future as well. But probably for a starting point, this is what we'd bring out, and we'd probably do a bit of a trial with her. So once we've actually got that winning option, you don't sort of just dump it and run and say, there you go, on your way. There's a few things you need to do to make sure that they're really going to understand all these steps. And in future sessions, this is something that we can go through in much slower detail and talk about all these things. But basically, you want to make sure that you're giving Paula education on how to safely set up that transfer bench and use it. We're probably, because we know she's quite anxious about falling in the shower, it's the first time she's used this piece of equipment, we'll probably do lots of practice actually transferring in and out. So we don't just give it to her, watch her use it once. We probably do, 10 repetitions and maybe come back on another visit if she's really not sure and do some more as well, depending on what sort of funding she has available for our visits. We could also do things like maybe take a video of how to set up the transfer bench or how you do the transfer, or even just send the link for that YouTube video to someone like her daughter, who can then continue the practice with her as well, so that it's not just our one-off visits. She'll keep having ongoing practice with her daughter, reassuring her and making sure that it's set up the right way. And then we also want to make sure that we have a plan for follow-up, so that we're going to come back and check, did this actually work? Because even if it works really well when we're out there for the first time, quite common for us, something to go wrong after we leave, and it will just stop the person from using it. And if we don't ever have a plan to follow up, did this work? We're kind of just assuming and guessing and hoping that it did the job. So that takes us to the last step of the process, which is to evaluate if it worked. So again, if you're watching the video recording, pause and have a think about how could you actually check if the transfer bench worked and what's your follow-up plan. So a few considerations for you to think about this. So in terms of how you can follow up, it could be that you do a follow-up phone call to Paula and just ask her whether she's using it, if there's any issues. If her daughter's been involved, you can maybe call her daughter and ask her as well, depending on maybe what you thought about Paula's cognition when you were doing those visits. You could actually go back and do another home visit yourself, and it could be that you do that sort of a week later or as much as 2 months later, depending on lots of different things. So these are the things that you consider to work out, how soon do I need to do a visit? What sort of follow-up visit should I do, or follow-up check? So it could be you're looking at how independent was she during our practice sessions. If she was actually really independent and confident, you may not be so worried and may just do a phone call follow-up. If we had concerns about her cognition, she was having trouble remembering the steps or was getting a bit confused, or even with lots of practice, she was still lacking confidence, we might need to actually go out and do another session with her, or call her and her daughter and check in on a few things. And you can also think about, do I need to go back and see Paula anyway for something else? And if you need to do that, will that coincide really with when's a good time to follow up this visit, so that you're trying to maximize your efficiency as well? So in this case, my winner would be that I'd probably get in my car and do a bit of a home visit. We're going to assume that maybe she was independent when we did the trial, so we were happy to leave the equipment there, but she still was lacking a bit of confidence. So we might give her a couple of weeks to practice, make sure her daughter's going to reinforce that with her, and then maybe go back in a couple of weeks and actually check and see it for ourselves. And maybe that she's got funding available to assess her difficulty with meal preparation due to her vision as well. So maybe there was another sort of part of the referral pending, and you're like, well, that makes sense. I'll go back out and do that initial assessment, but while I'm there, I'll be able to evaluate whether that transfer bench worked and actually look at that myself as well. Now, if it doesn't work though, you go there, do the evaluation, and it's buried under a pile of clothes in her laundry because she turns out she didn't like the transfer bench. What do you actually do? You need to do some further information gathering about what was the issue, why didn't it work, why doesn't she like it, all those sorts of things. You might need to trial some different options for equipment. And if you've got a supervisor, even as a new grad, then that's a perfect option. If you're feeling a little bit lost and you can't quite, decide what's the next thing I can try, then having a chat through with a supervisor is really important as well. So that's sort of the end of the process and really kind of the end of this session. I know I've flown through it super quick. This is kind of a bit of a taste for some of the things that we can do next year when the session actually launches. And again, we can either do quick ones that you can pause and work through in your own time, or we can do some slower ones and just focus on one step of the process in a lot of detail and really discuss things. So very happy to hear what people would like and what they think will be most beneficial for their learning, and try and tailor it to suit lots of different people's learning styles. So if you're still here watching it, now for the big question, what is sort of your big take-home message from this session? So was there one part that really jumped out at you? It's like, oh, using the PEO was actually helpful to plan the session. Or I often see people forget about the evaluation step. How can I make sure that I always plan that into my session? So have a think about what's something that's really important that's jumped out to you that you think you might be able to start using straight away. And then just to wrap up, I just wanted to let you know that coming very soon, probably by the end of this week, fingers crossed, all the free stuff that's currently available on my website. And if you haven't had a look on my website, jump onto the website and look for the Learning Library tab. There's free downloads, there's lots of webinar recordings, things like that. There's also some webinar recordings on my YouTube channel that you can find. And I'm going to be doing a few more Your OT Tutor tutorials, which are probably more so for experienced OTs, but students and new grads are welcome to come along as well, where I do a little bit of a deep dive into practical things. So all of these things are freely available. All this Learning Library content will be part of the student membership as well, so you'll be able to find it all in one place if you do sign up for the student membership. So what I'll do is I'll hang along and answer any questions that anybody has. If you've got any suggestions for whether you'd like sort of quick sessions like this or slower, one step at a time, half an hour talking about each step of the process, very happy to hear what you would like to do. Or if you have a question, I'm going to stop the recording in a second, and you're welcome to ask that off the recording if you don't want to be recorded. But for those that are trying to find me as well, the easiest way to get in touch is via my email. So you can email me directly. On the website, there's also a contact form that you can use. Or if you're looking to see what else I've got coming up as well, that bottom link, which is kind of like my link tree, has all my best or upcoming courses or webinars and sessions and things like that. So there's other ways of finding me there as well. So if anyone's got any questions, I'm going to say goodbye to those that are watching the recording. For those that are live, I'm going to hang around for anyone that'd like to ask me a question. But thanks so much for coming along today. And hopefully, if you like this sort of information, I'll see you in the Connector membership next year. Thanks for watching. Okay, stop recording.